have our outline, the introduction, definition, anatomy and physiology, causes, type of cystitis, physiology, pathophysiology, clinical manifestations, complications, corrective care, blessing management. So the general objective is, by the end of this lecture, students should be able to acquire knowledge on cystitis. And then the objective, by the end of this lecture, students should be able to define cystitis, explain the types of cystitis, know the pathophysiology of cystitis, know the signs and symptoms of cystitis, manage the patient with cystitis. So, introduction. Cystitis is one of the diseases of the urinary tract infections. Cystitis usually occurs when bacteria that can live harmlessly on the skin or in the bowel enter the urethra and the bladder. So the bacteria then fastens to the lining of the bladder and causes the area to become irritated and inflamed. This is known as the bladder infection. So with urinary tract infection, so when you look at the prevalence, it's more higher in women than in males. For in women, it's because of the shorter urethra, and in males, it's because of the prostate hypertrophy. So cystitis can affect anyone regardless of sex or age, but it is more common cluster source among females. One reason for this is that females have a shorter urethra that is closer to the anus. This means that the bacteria can enter the bladder more easily. So we look at the definition of cystitis. So cystitis refers to infection of the lower urinary tract, or more specifically, the urinary bladder. So cystitis may be either acute or interstitial. Acute cystitis, that happens suddenly. So we know that acute, it's something that just happens just then and then, and it's not that, it doesn't prolong. Interstitial cystitis is longer term and is also known as chronic cystitis. So in some, when maybe search on the internet or in other books, you find interstitial cystitis. So this is a diagram which shows you the normal and the abnormal of the bladder. So the normal is just normal, and then cystitis is one where it's inflamed. So this reddish part shows you that it's inflamed. So you can see the kidney, urethra, bladder, urethra, the urethra, bladder, urethra. So it's on the other side. So the inflammation part is on the bladder. So that's our concentration today. So anatomy and physiology. The bladder, the storage sac for urine, which is lined with a mucous membrane and coated with a protective protein layer. As a result, it is usually highly resistant to infection or irritation. So what we can know about the bladder is it's a storage sac for urine. So it holds, the function of the bladder is to hold urine, which is about 250 mils to 600 mils for adults. And then it helps in helping out in terms of acquiring, releasing, or pushing through the urine. So when the bladder is hollow shaped. So when there's urine inside, it gets an oval shape. So when it's deflated, meaning the urine passes through. So meaning the shape also changes. So this is the male urinary system. So you can see the kidney and the bladder. And then that's the female. So causes of cystitis. We have residue urine in the bladder, urogenic bladder, urethral stricture, prostatic hypertrophy, instruments, chemicals, clothing, bacteria like Escherichia coli, gram-positive cocci with chondronic catheter catheterization, urethral dilation, cystoscopy. So for residue urine in the bladder, the residue urine in the bladder it should not be, the urine should not be more than 250 mils. The urine in the bladder is the urine that remains in the bladder. So it shouldn't be prolonged, because what causes residual urine in the bladder is that there might be a malfunction of the bladder in terms of storage, and when there's residue, meaning they're able to acquire infection. Then we have urogenic.
You say when there is residue.
Residue, meaning in the bladder, the bladder is not completely emptied.
It's not emptied.
Yes.
There is always residue.
Yes.
There's always residue. If you empty your blood, there's always some residue.
This is where you fail to control your sphincter to release urine. So the urogenic bladder, it's why the nerves are failing to work as they are supposed to work. So this happens in maybe when you have a traumatic injury of brain tumor, or you have Parkinson's disease. So you can have urogenic bladder and you'll be failing to release urine. So you'll be able to have infection easily. Then urethral stricture, this is why the urethra is narrowed. So you'll be having releasing urine partial or incomplete. And then you have prostatic hypertrophy. So for prostatic hypertrophy, it comes in as a result that the prostate enlarges, it creates an obstruction where the urine flow is disturbed. So it will be partial flow or incomplete. And then we have instruments, chemicals, and clothing. So for instruments, we have maybe for examinations, they might not be sterile. Chemicals, we have dyes, we have lotions that might irritate the urinary tract and can pass through the urinary system to reach the bladder. And then we have clothing. So for clothing, people who wear tight clothing might disturb the bladder by where it's too compressed, creating obstructions.
No, it's just the clothing. Girls, let me explain. I don't want about clothing. Girls, what about it? It will tract. Can you explain? Those, the owner of the cystitis. Clothing. Now does it call it cystitis? Even when you flat,
Madam.
Scandal. Girls should know. It's not about cystitis. It's about what?
I know it's tightness.
Auntie? It's tightness. Next. Because this is your way, all of you should know. Next.
I think for the clothing, Madam, we extend your force and what's
Let's say no clothes. Which level of clothes? Skirts.
The underwears. Trousers.
Trousers. What else? I'm looking for something from girls. Yes, babe.
But I'm not sure. Usually what happens, because our vagina releases certain fluids. Our vagina releases certain fluids. So they say it's more advisable to wear cotton pants than wearing a different kind
if you don't go to pads, and then these girls, some of them, they don't have pads. What do you use? What do you use when you don't have pads during that time?
Clothes.
Surface is surprised. That's not what we are not right. But it is better, but the village girls, they don't have clothes. They use the clothes. Now if that have clothes is dead. You see that? It's a source of infection. You are saying they read that it's and the blood that causes some infection. That's not wearing. And I want if it was something to put wearing tight. A lot of cystitis.
Bacteria like Escherichia coli, gram-positive cocci. So with the bacteria, I think, or for the bacteria, we do know, looking at the presentation that he went through. And then you have the indwelling catheter. So for indwelling catheter, you might find that you have issues also of emptying and sterility. That's also with the same characterization. And then urethral dilatation, it's when you're taking the urethra. So when emptying, the possibility of infection comes high, even cystoscopy, that's during the examination.
Urethral dilation,
Yeah, so when you dilate the urethras, so there will be no constriction, so meaning the urethra will keep on passing urine, and then the chances of infection can be high because they're not able to control the...
It's the issue of urethral dilatation. Maybe the equipment they use to dilate is
not sterile.
Not sterile, yeah. But if you dilate, then the urine is passing, then you are not with the cystitis. It's just the dilatation.
Then in women who are going through the menopause,
I'll come.
in women who have had or are going through the menopause, the lining of the urethra and the bladder becomes thinner. This is due to lack of the hormone estrogen. Then this lining is more likely to become infected or damaged. Women also produce fewer vaginal secretions after the menopause, which means the bacteria are more likely to multiply. In women, the urethral anatomical position of urethra is short. So in men, there is a presence of zinc prostatic fluid to prevent urinary tract infection. However, men who are not circumcised are at greater risk of developing UTI, that's urinary tract infection. So for men, I think we know what it means when you're not circumcised, how you can get the infection because of the foreskin. So this is a diagram of some of the causes.
Now, for men, you are saying for men, you know, but you are not telling the girls.
For the girls. No, as in I'm telling you. I'm from mentioning it. Yes.
How?
When I say, however, men who are not circumcised are greater risk of developing. However, men who are not circumcised are greater risk of developing urinary tract infections because of the foreskin. So the foreskin is able to acquire infections because it depends, especially if there are those men who are able to clean, then they're okay. But for acquiring the infections, they can also acquire them through sexual activities, or lack of hygiene.
Yeah, so just lack of hygiene inside there, what we call cystitis. It will just continue to accumulate if you don't clean it, put your basket clean and you put it back. So if they will accumulate, then they will enter the rest and yeah.
So these are diagrams which show, that one shows an inflamed bladder, stomach aches, bed rest, and then the issue of being female, then condom, constipation, microbes, cystoscopy, kidney disease, difficulty urinating, backache, diagnostic sonography, intestinal disease, cold, and many sexual partners. So for the GIT, we do know that there are bacteria that can go to the urinary tract. And also the issue of many sexual partners. So this is an example of multiple sexual partners that can get urinary tract infections. Then there's also tight clothing and the bladder distance greater. So in men, you can see that it's very, very long compared to women. For women, it's short. So you can actually see the distance so that you know the cause on which one is more likely to be prone to disease. So this is the same diagram in a different position. So we go to types of cystitis. So cystitis occurs due to bacteria or fecal flora that occupy the urethra. So these are pathogens
You just write your question first,
which reach the other urinary organs such as the bladder, ureters, and kidney through the urethra. So we have infectious cystitis. It occurs due to either bacterial, fungal, or viral infections. And when infection spreads to kidneys, the symptoms can be fever and blood in the urine. So the bacterial species are such as E. coli, Klebsiella, pneumonia, Enterobacter, while fungi such as Candida species, and viruses such as adenovirus, polyomavirus. So we all know that infections can cause inflammation in the bladder. And then we have interstitial cystitis. It causes recurring discomfort and bladder pain. The symptoms may vary between patients. However, the bladder pressure, tenderness, or intense pain in the pelvic area are common symptoms. Then we have eosinophilic cystitis. This cystitis is very rare, in which eosinophils build up the bladder build up in the bladder. Allergic reactions, skin conditions, inflammations, cancer, and bone marrow increase the production of eosinophils in the body. So we know what happens when you have a lot of allergic reactions in the body. We are more prone to more infections. Then we have hemorrhagic cystitis. It refers to the abrupt onset of blood in the urine, known as hematuria, and is often associated with cancer therapy such as radiation, chemotherapy, and exposure to hazardous chemicals. So radiation cystitis occurs due to radiation therapy in the pelvic area. Radiation triggers inflammation in the bladder tissues or blood vessels. So when you go to the hospital, you can also get radiation. For example, in the X-ray department, you find that they wear protective clothing because those rays can affect your urinary system, while they affect mostly the bladder. So that's how radiation cystitis comes. Then we have follicular cystitis. It occurs due to long-term chronic cystitis, during which there is a change in the bladder lining. The lining of the urinary bladder may have mucosal brown nodules. Some cases of follicular cystitis cause mucus thickening of the bladder, which appears purple color. Then you have cystitis, cystitis, refers to the stomach, a parasitic platform that affects the whole body. Contaminated water containing the parasite larva attaches to the skin and enters the tissues. These parasites cause inflammation, ulcers, and bleeding. Then we have cystitis, which is a chronic UTI with calcium salt deposition in the bladder because due to the infection of the urea secreting bacteria, Conium bacterium and Ulitium campus. So episematous cystitis. It occurs due to the formation of air blimps in the bladder wall due to gas-forming pathogens such as Escherichia coli, Proteus, Morbus, and Enterobacter pylori. Most often it is associated with diabetes. So for our main concern is interstitial cystitis. It's interstitial cystitis. May I call on Memora to do the pathophysiology?